So I'm Christina Sheppard. I'm a transplant financial coordinator at UC Davis Transplant Center. I've been a financial coordinator for close to about 18 and a half years. So I have quite a bit of experience. Today I want to take you through the role of the financial coordinator and the services that we provide to you as transplant patients. One of the things we do when you are referred to our center is we research your transplant benefits. We are like private investigators. We look for any limitations, any exclusions, any hidden language, anything you should be aware of on your policy. We counsel and educate the patients on the costs of pre- and post-transplant care. I would say on an average counseling session over the phone with the patient can run anywhere between 45 minutes to an hour. For me, as a financial coordinator, I want to make sure that all of my patients are aware of the commitment that they're making. And I don't want them to stress afterwards, after having a transplant. I don't want them to be worried about their finances. Can I afford my medicine? That type of thing. We assist our patients with developing a long-term financial strategy. Your organ that you receive, you're going to have to take care of it for the rest of your life.
Yes.
And the reality is the medications are expensive. It's going to be labs. It's going to be ongoing maintenance. So we really help you not only look at just transplant itself, but life after transplant as well. We discuss a plan for ongoing insurance coverage, and I'm super happy that we have the Affordable Care Act, because there was a point in time where people were not able to get insurance, and they were turned away because they couldn't afford to pay for a transplant. We talk to our patients about going back to work, and if you're on Social Security, getting back into the workforce, and life after transplant, preparing you for what's going to happen when your Medicare may terminate or your Social Security benefits may terminate. We secure authorizations for all transplant-related services. So your financial coordinator, myself included, not only do we work with you pre-transplant, but we stay with you post-transplant as well. So I always say, like, the kidney is our wedding ring. But you do always, we not only obtain the authorizations for the pre-transplant, the transplant event, but post-transplant as well. So one of the things that we do is, as I discussed earlier, we obtain your insurance benefits and we discuss them with you in great detail. We obtain any information as far as what will your copays be for in or outpatient services. Prescription copays, this is a big one. Some of our patients, they don't really look at their insurance plans. They don't look at their prescription coverage. And the anti-rejection medicines that you have to take post-transplant are sometimes considered specialty medications. And so you could have a higher copay. So we look at all these things, we price the medication, and we give you an idea as far as what you can expect for the out-of-pocket cost, and make sure that you're comfortable with that and that you're aware of that. We check policies to see if living donation is a covered benefit. For patients who live quite a ways away, one of the expenses for transplant is travel and lodging. We have patients that come from Reno, Southern California, even travel from the Bay to Sacramento. Gas, there's toll, there's all these other things. We look at Medicare entitlement, and we talk to our patients about the coordination of benefits. And one of the big things is we always look to make sure that whatever your insurance is, we are contracted for transplant. We may have, with transplant, the benefits are always carved out, so we may be contracted with your insurance, but we may not be contracted for transplant itself. So that's happened several times. And we work with all different types of insurance plans. So some of the costs that you will experience as far as the transplant surgery and the hospital stay, we give you an idea of what your copays will be, what your out-of-pocket expense will be. If you have a maximum out-of-pocket on your policy, we always ask to see how much you've met so that you know how much you have remaining for the remainder of the year. The post-transplant medications, probably through your first through third month. Your discharge meds, if you were paying cash out of pocket and you didn't have any insurance, could run anywhere between $4,000 to $6,000 a month. This is always the hardest call for me to make, when I have to call a patient and say, you're going to need approximately $3,800 to $4,000 for your drugs. If you have Medicare and a supplemental policy and a Medicare Part D plan and you do not qualify for the low-income subsidy, one of the medicines that you take post-transplant will definitely knock you into your donut hole, and within your first 3 months, your average cost is going to be about $3,800. Now that's not going to be per month, but that's for the whole year. But you're going to hit that $3,800 super quick, just depending on where you're at in your coverage gap. Some of the other post-transplant, the cost of transplant services are, the follow-up. You're going to have to come to clinic. There's copays associated with that. You're going to have to go to the lab a couple times a week. Specific policies may have a copay every time that you go to the lab. And ongoing services, radiology service, rehospitalizations, biopsies, and of course, travel and lodging. So we take a look at the big picture, the whole big picture. Some of the pre-transplant financial issues, the patient cannot afford the out-of-pocket costs, and that's including copays for medical services, medications, and insurance premiums. That's probably one of the hardest things for me, is to have a patient say to me, I can't afford this. And really my role as a financial coordinator is to get my patient to transplant, to be their cheerleader, to be their advocate, and let them realize that this isn't not an absolute contraindication to transplant. We can get there. So we really encourage, I encourage my patients. I talk to them about fundraising. I talk to them a lot about what can we do to get you where you need to be. Another one of a major issue is if a patient has Medicare or Medi-Cal with a high share of cost. Medicare only covers 80% of the immunosuppressant drugs. So the 20%, if you had a high share cost, could average about $200 to $400 a month. If the patient has Medicare only, the expense that they will be liable for, 20% after Medicare's payment for outpatient services, and again, 20% for the immunosuppressants, because those are covered under Medicare Part B. This is a major one. If somebody's coverage changes or terminates, we have that happen all of the time. And most of the time it is for patients who are on the wait list and they're getting called in and they haven't informed us that they have a new coverage. So this is something we deal with constantly. They're in the hospital, they've already gone to the OR, and it's post-op day 3, and we now find out that they have a new policy. That actually happened to me last week. So thank goodness I was able to secure a retro authorization, and my patient, I was just like, why didn't you tell me? But it all worked out okay. If the American Kidney Fund pays your insurance premiums while you're on dialysis, that does assist you while you're on dialysis, but the reality is that they do not pay them after transplant. And so that becomes your financial responsibility. And so it's really important that we look at, can we get you to transplant? Yes, but what's going to happen afterwards? And really preparing you for, what you're going to be hit with as far as a financial impact. So these are some of the important questions that you should ask. If you are being considered for transplant and you are the one that you're the subscriber to the health insurance, you need to ask your employer, what's going to happen to my insurance while I'm off work for transplant? The common answer I always get is, oh, it'll be covered. I'll be insured. So once you exhaust your paid time off, do you know what's going to happen to your insurance? Do you know how long your employer is going to continue to pay their portion of their premiums? Do you know if you have to pay your portion of your premiums? So it's always good to find out what's going to happen to your insurance once you exhaust your paid time off, and definitely finding out how much paid time off you have. How much are your insurance premiums going to be? So not only have I called you and we've talked about how much your medicines are going to cost and how much your medical services are going to cost, now we're going to talk about what other expenses are you going to incur. And when you actually have to pay for your insurance premiums, whatever it may be, your portion or COBRA, we have to take that into consideration and look at the big picture. When do you file for disability? A lot of times patients want to, you know, they maybe already be on Social Security disability, but for patients that are working, this is a huge concern because their income is, you know, once they exhaust their paid time off, they're on disability, their income could be cut. Most of our patients, they don't file for disability until they're transplanted. Does your employer offer short and long-term disability? That's a super important question to ask. Ideally, you would go back to work after transplant, 8 or 12 weeks. What if that doesn't happen? So you really want to look at not only just the transplant itself, but prepare for the what ifs. And what if I'm unable to return to work? So we kind of walk through all of those scenarios with our patients to make sure that they have all the answers that they need. I always tell my patients, this is your homework assignment, you know, call me back after you find out, because I don't want any of my patients to have to deal with this after transplant. After transplant, I want them to focus on getting back to life as it should be. COBRA. Is COBRA an option? That could be very expensive. I've seen some COBRA policies run anywhere from $500 to $1,100 a month. And again, if the American Kidney Fund is paying your insurance premiums, can you afford them post-transplant? This is a huge one. Can I afford my out-of-pocket costs for medical services and medications? So when I counsel patients, the majority of the time, I will, tell them this is what your estimated out-of-pocket costs will be. And, the common answer I may get is, well, I have to make it work. And so I do tell my patients I'm not trying to get in your business, but that's not an acceptable answer for me. Let's talk dollars and cents. Let's talk about your life. Let's talk about the financial impact that this is going to have on you. And I, as a financial coordinator, have to feel 100% in my gut that this patient can do this. And if they can't, I want them to be honest with me, and I want them to be able to work towards getting a transplant, because sometimes people can't afford it. So, so a lot of times I'll push them if they just give me that generic answer. What should I do if I'm on the transplant list and my insurance is going to change? The number one rule I have for my patients is, please do not make any changes in your insurance unless you contact me first. Sometimes you may change to something that you think is good, that somebody said, oh, this is a good plan for you, the drug coverage looks good, and it may not be good for you as a transplant patient. So if you're on the transplant list and your insurance is going to change, there's authorizations that need to be secured. We take care of all of that so that you don't have to worry about any of that. But as I stated earlier, we do have some patients that no matter how much I tell them, don't change without calling me, sure enough they do it, and then we have to try to get everything in place afterwards. Do I qualify for assistance programs? There may be some drug assistance programs that patients may qualify for. We do have patients that are post-transplant and they've had a life event, they've lost their insurance, they've lost their job. And so, sometimes we have to get them very quickly enrolled in prescription assistance programs. And the key thing is, if ever there is a problem with the cost for your medication, make sure you communicate with your financial coordinator or your post-transplant staff so that you do not go without the medication. Most prescription companies have allowed, they've changed their income requirements so that people with higher income could qualify. If I'm on Social Security disability and Medicare due to ESRD, will it last forever? If your kidney is functioning successfully 3 years after transplant and you are on Medicare or Social Security and you have no other linkage such as age or disability, your Medicare and Social Security benefits could terminate 3 years after transplant. What resources are available if I'm on Social Security disability and I want to return to work? There's the vocational rehabilitation program. We counsel our patients. We talk to them about, what do you want to do? Take advantage of this program. Let's get you back into the workforce. So there's a lot of not only pre-education but post-education as well. And what type of insurance will I need as a transplant patient? As you go through this process, you're going to learn what type of benefits you need, what type of prescription coverage, the things that you should be asking for. How much is my insurance going to cost me monthly? And who's going to help me figure all this out? That would be us, the financial coordinators. We are tasked with helping you figure all of this out. And as I stated earlier, you know, we not only stay with our patients pre-transplant, but we stay with them post as well. We're always here to guide them, to answer any questions, because we want our patients to have a successful outcome. We don't want our patients financially stressed after transplant. So please rely on your transplant financial coordinator at your transplant center. You know, they are the go-to people when it comes to transplant. And communication is key to your patient success. Again, communicating with your financial coordinator. Financial roadblocks are identified, and together the patient and the financial coordinator will work to resolve any financial barriers. Sometimes my patients want me to figure it out for them. And I don't have a secret fund. I wish I did, because then everybody wouldn't have to worry about this, you know, having to pay huge out-of-pocket costs. But together we can overcome any financial, you know, the majority of all the financial barriers. And your financial coordinator is, again, a resource to you that's available pre and post-transplant. And here's some funding sources. I'm super happy that we have, you know, the Cover California. Patients have access to Medicare, Medi-Cal, private insurance. If you've served in the military, the VA is another resource for medications. And fundraising organizations, that's huge. I talk to my patients all the time about fundraising and really setting up a fund so that you're not having to drain your credit cards and you're not having to pull from your life savings. It's a time where you allow the people in your life that love you to help you. And sometimes it's hard to humble yourself to do that. But as I tell my patients, this is only one moment in time. And we just have to get you through this and get you back to, again, back to life as it should be. And some other funding sources are prescription assistance. And that is it.
Thank you.
I stay within my time.